to the next piece of our agenda and the next piece of business, which is the message from Taoiseach, Mr. Micheál Martin.
President, Vice Presidents, General Secretary Phil, staff of the INMO, members, colleagues, distinguished guests. I would like to thank you, President, for inviting me to speak at this annual Delegate conference. I last attended your conference as Minister for Health when I announced the introduction of the Nursing and Midwifery degree programme in 2002. This was a very significant milestone at the time for your profession and for the provision of patient care in our country. I have attended many INMO events over the years and feel an affinity with your organisation, as my former advisor and friend, Governor O'Connell, was an industrial relations officer with the INO, as it was at the time, for many years. Governor epitomised the progressive nature of your profession, and I'm glad that you still honour her memory and contribution with your annual award recognising outstanding nurse reps. My Chief of Staff in the Department of the Taoiseach, Deirdre Galan, was a colleague of Governance in the INO also. As you know far too well, the past year has been a difficult one for you and your colleagues throughout the health service. COVID-19 has brought severe illness, suffering and loss to so many of our people and their families. It has demanded so much in terms of flexibility, capacity and innovation from everyone involved. It has asked us to dig deep over and over again, with great uncertainties prevailing throughout. Throughout all of this, you and your colleagues in the health service have continued to work diligently, demonstrating so visibly the commitment and dedication to providing care for our most vulnerable and ultimately saving lives from this terrible virus. I'm deeply conscious of your courageous contributions to the national effort, the risks many of you have faced, and most painfully, the tragic loss of some colleagues. And I must sincerely and humbly thank you all for your continued perseverance in the fight against this virus. 2020 was designated by the WHO as the year of the nurse and midwife before the pandemic was declared. This unfortunately resulted in many of these celebratory events being postponed. However, through your response to the pandemic, 2020 resulted in the role that you all play being amplified across the nation. And the public have shown their deep appreciation of your profession. In that same spirit, the government is committed to recognising the great dedication that you and all the healthcare workers made during the pandemic, and work is ongoing to determine how best we do that. Your roles have undergone considerable change over the past year. Nurses and midwives have implemented telehealth technologies and have demonstrated huge innovation, responsiveness, and extraordinary commitment in bringing care to the people that need it and meeting the challenges in the health service as this pandemic emerged. In recent months, nurses and midwives have been at the forefront of coordination, planning, and rollout of the vaccination programme, and indeed in taking lead roles in the establishment of community vaccination clinics. And as you all know, the vaccine programme is a key enabler to the reopening of society and the economy on the path out of the pandemic. The government is committed to the continuing development of the profession as we look to the future needs of the health service. As you know, Sláinte Care is the major reform programme to transform our health and social care services. It incorporates a number of nursing policies already developed through collaboration by the INMO, the HSE, and the Department of Health. These and other reforms are already at various stages of implementation. The number of nurses and midwives working in our health service are at the highest levels in over a decade. As of the end of March 2021, we now have almost 41,000 nurses and midwives working in our public health service. Of those, 2,105 alone were added in the past 12 months. This increase in recruitment has been critical in supporting the health service in delivering care during the biggest public health crisis in arguably a century. As we expand the nursing workforce, Policy development, such as the development of a framework for safe staffing and skill mix led through the Chief Nursing Officer's Office, is critical. The development and deployment of the nursing workforce must be evidence-based and drive quality patient outcomes. The number of nurses and midwives working at advanced practice level is nearing that critical mass target that is required to sustain this model of care. I envisage the recommendations of the expert review body of nursing and midwifery will help drive further progressive change in the nursing and midwifery professions as we continue to implement Sláinte care. We must also acknowledge our student nurses and midwives who have continued their education throughout the pandemic and have demonstrated the commitment, care and competency that citizens expect of our graduates. To support student nurses and midwives, the government is implementing the Collins recommendations, including the €100 per week pandemic placement grant. Additionally, the government commissioned a longer-term review of nursing and midwifery students' allowances and internship pay to support students during their education, and the Minister of Health and I look forward to examining the findings in due course. With your help, Ireland is getting ever closer to emerging from the COVID-19 pandemic. I am, and indeed the country is, profoundly grateful for your commitment and bravery in delivering care and maintaining the highest standards for our patients during this most testing period for our society. This crisis is not over, but there's a real sense that we're making considerable progress. With your help, brighter days are ahead. I hope and trust that you have a productive and interesting conference, and I look forward to meeting you all in person when circumstances allow. For now, I wish to take this opportunity to thank you again sincerely for all your work. Gurv Míle Maithagüibh Galéir.
Thanks. Thank you, delegates. Thanks to the Taoiseach for his address to conference, and is noted that this is the first time that Taoiseach has ever addressed our conference, so it is a memorable moment. The Cork influence is strong within the INMO, and I can assure you all that our first Vice Eilish and second Vice Catherine had no influence in that at all, to which I'm eternally grateful for all their help. It is appreciated that the tireless work and extraordinary efforts by our nurses and midwives is acknowledged, as the weight of the entire country's health lies on their shoulders. The Taoiseach rightly stated that there is an increased number in recruitment of nurses and midwives within the workforce. However, a large portion of that are our valued students. Colleagues, let's be very clear here on the Collins report payment. This needs to be paid to our students, not discussed, not debated, just paid. The retention of these members will be a bigger problem, as the fallout from COVID-19 will be the mass exodus of our colleagues. We welcome his comments, and it is right that the Taoiseach of the country acknowledges the commitment and bravery shown. This is not a coincidence that the recovery of our patients from COVID-19 is taking place. The experience and the ability of our nurses and midwives is extraordinary. He states that the consideration is being given to rewards for nurses and midwives. The Taoiseach and government must move from consideration to implementation, because we as nurses and midwives didn't have the time to consider anything about COVID-19. We implemented and overturned our workplaces and got on with it. We will hold him to his commitment made on the compensation to nurses and midwives, and this is in line with our emergency motion. You will all have the opportunity to express your view on the Taoiseach's acknowledgements of your extraordinary efforts during this pandemic. We will have the Minister of Health address conference tomorrow, and we have a set of questions for him to answer. Delegates, thank you for your contribution today. We are closing, and I encourage you all to join bright and early tomorrow morning at 9:45 so we can get online and get on with the business. We will be discussing the emergency motion prior to the Minister's address, and you all have the text within your hands. So let's bring on this healthy debate tomorrow. thank you again for your time and thank you for your participation today.
Thank you all. Thank you,
That's great.
President.
Thank you, General Secretary. Thank you.